Good day, agents. As you know, there's a big buzz right now in regards to some of the changes that CMS has made that's going to affect you for 2024 and possibly sooner. As we've analyzed the Center for Medicare and Medicaid Services 2024 final ruling for Medicare Advantage and Part D plans, we've noticed the changes that will most likely impact agents like you. For this video, we've selected 10 rules that we know will probably make an impact on your business. Now, each year, CMS reviews their policies for Medicare Advantage and prescription drug plans. They then propose changes and then issue a final ruling on what's changing for the upcoming year. It shouldn't come as a surprise that CMS has initiated some harsh changes for 2024. However, they did soften some of the rules. A few of the proposed provisions were not included in the final ruling, but CMS has stated they may adjust these in the near future. The following rules will go into effect on September 30th, 2023, just before the 2024 annual enrollment period begins. While these changes are going to going into effect in a few months, please take a minute to review the full 2024 final ruling now, just to start preparing for what's to come. If you don't have access to that report, let us know. It's 724 pages long. If you email agentsupport@4tbrokerage.com, put in your request, we'll email a copy as soon as possible. Okay, so new Medicare marketing rules for agents. Rule number 1 that we've chosen to talk about prohibits the use of government products and information in a misleading way, including the Medicare name and CMS HHS logo. So moving forward, agents may not have the name Medicare in their business name, logo, or URL. And this affects a good number of the agents that we work with. Now, through CMS's surveillance of activities and beneficiary complaints, CMS has noted there have been, or at least they've seen the word Medicare and the Department of Health and Human Services logo being used in names of storefronts, postcards, websites, printed material, and it's being done in a misleading manner. So CMS also noted that there are numerous third-party internet sites with Medicare in the URL. So CMS is concerned that beneficiaries are being misled into believing that they're actually communicating with the federal government or its representatives. Because of this, CMS is going to be adding new language in the Code of Federal Regulations to further restrict the use of the Medicare name, CMS logo, and products and information issued by the federal government in a misleading way. CMS also states in the final rule that they will be holding the Medicare Advantage organizations, like the carriers, they're going to be accountable for the actions by their first tier, downstream, and related entities. Clearly, CMS is targeting those red, white, and blue commercials that we've all seen too often. However, the new restrictions will no doubt increase the scrutiny of agents and brokers' marketing activities. We believe it's unlikely that carriers will approve communication or marketing materials that include the word Medicare or have the Medicare card or other than to describe the product type, like Medicare Advantage and Medicare Supplement. More than likely, further restrictions will probably be added in the Code of Federal Regulations. Okay, so rule number 2 modifies the TPMO disclaimer. TPO is third-party marketing organization, basically agents. Remember last year when we were told that we had to add the disclaimer to our websites, emails, and other advertisements? Well, now we have to add the word ships. We have to add the number of Medicare Advantage plans or Part D sponsors and the total number of products available to the beneficiary that we're offering. So if you're marketing Medicare Advantage and prescription drug insurance products, you must include appropriate revised TPMO disclaimer on all marketing materials in your website and emails, whether it's print, electronic, website, and also within the first minute of any audio scripts or calls. The disclaimer must be specific to the beneficiary service area. So for agents out there that do not sell all Medicare Advantage plans or prescription drug plans within a service area, here's how your disclaimer needs to read. We do not offer every plan available in your area. Currently, we represent X number of plans, or not plans, but we offer X amount of carriers, which we also offer an X amount of number of plans and products in your area. Please contact Medicare.gov, 1-800-Medicare, or your local state health insurance program, SHIP, to get information on all your options. Now, for agents that do sell all Medicare Advantage plans and prescription drug plans within a service area, which I'm not sure it's possible here in Michigan, here's how your disclaimer needs to read. Currently, we represent X number of organizations which offer X number of products in your area. You can always contact Medicare.gov, 1-800-Medicare, or your local state health insurance program, SHIP, for help with plan choices. It's getting ridiculous, but this is a new regulation coming for next year. Rule number 3. Prohibits the use of superlatives in most marketing unless documentation is provided to support the statement that is based on data from the current or prior year. So basically, agents cannot use superlatives to describe plans unless also providing recent factual data that supports their usage and meets CMS requirements. So these words include best, most, largest, lowest, and this applies to marketing and communication materials. So rule number 4, prohibits the marketing of benefits where they aren't available unless unavoidable because of use of local or regional media that covers the service areas. So when marketing plans and benefits, agents must target only beneficiaries who are in the plan service area unless it's impossible to accomplish that due to the nature of the ad. So for an example of an unavoidable situation, includes a newspaper ad in a metropolitan area distributed to beneficiaries who live within that metropolitan area but might be outside of the planned service area, or a TV ad that could be picked up in an adjacent market. Remember, this rule in particular, when you're marketing 5-star plans, special need plans, and Part B give back plans, because I think that's where the biggest issue is coming from. So rule number 5. Now we're going to talk about updates on permission to contact and scope of appointments. With CMS's new ruling, it seems like we're going backwards next year because CMS is now requiring that we get a scope of appointment signed 40 hours before the actual appointment is completed. And there are some exclusions, but if you remember, a few years ago, that was required all the time. So one of the exceptions to this rule is when a beneficiary is approaching the end of a valid enrollment period, such as AEP, OEP, SEP, ICEP. And then also another situation would be if you had an unscheduled in-person meeting, like a walk-in, where the appointment was initiated by the beneficiary. All right, so rule number 6, limits to how long scope of appointments and business reply cards are valid. There's now a time limit in writing for scope of appointments and business reply cards, and it's 12 months. You will need to get a new scope of appointment or permission to contact if the original has expired. Now, one of the things that we're recommending that our agents do is keep track of the start and stop date within your CRM because you want to make sure that you're maintaining compliance with this new ruling. Okay, so on to rule number 7. This clarifies the prohibition on door-to-door contact. We know that there are agents out there that are door-to-door reaching beneficiaries, which if you're doing it for Medicare Supplement, it's okay. But what happens is this still applies after receiving a business reply card without prior appointment citing that it's not the beneficiary's intention to give permission for an agent to show up unannounced at their home after filling out a business reply card. So CMS reiterates that it remains illegal to go door to door when marketing Medicare Advantage plans and prescription drug products. Collecting a BRC is not a substitute for permission to knock on a beneficiary's door without having a scheduled appointment with the beneficiary at a specific time. So on to rule number 8, Medicare call recording clarifications. We all know that last year we had to start recording phone calls, And here's the newest update on it. So there are now limits to the requirements to record calls. Marketing, sales, and enrollment calls are the only types of calls that need to be recorded per CMS. Marketing includes retention-based marketing or influencing a beneficiary's decision to stay enrolled in a specific plan. Agents should not need to record calls simply to set an appointment or check in after the sale for a retention phone call. However, my recommendation is to record every single phone call so that you don't have to worry about it and you're always in compliance. Now, if you don't have a solution to call recording, since last year, we've worked at figuring out a solution for our agents, and we negotiated rates with a VoIP phone provider that integrates with Agency Block, and it will auto-record every phone call, inbound and outbound, and then store all recorded calls. If you like more information on this application or how to receive your 4T discount, please reach out to me or agent support at 4tbrokerage.com. Please understand that this recording requirement applies to video conferencing as well and other virtual telepresence methods. When conducting marketing, sales, and enrollment calls virtually like Zoom or GoToMeeting, agents must still record the call. However, only the audio portion is being required, not the video portion. Rule number 9, revisions to Medicare education and sales event rules. This rule restricts appointment setting at educational events. So for those of you who are doing educational seminars, whether they're dinner or snacks or whatever, what happens is now during educational events, agents can no longer collect scope of appointments or schedule future appointments. What agents are allowed to do is collect a business reply card and permission to contact to distribute business cards at these events. We no longer allowed to schedule the appointments at the event. Okay, so on to rule number 10, the last one here. Limits marketing events occurring after educational events. So in the past, if an agent conducted an educational event, you were able to conduct a subsequent sales event in the future. So this previous ruling was vague, and agents abused the vagueness of the ruling. And what they were doing is completing enrollments 10 minutes after the educational event because it was later. Now, CMS says that the marketing event or enrollment cannot take place within 12 hours of an educational event in the same building or an adjacent building. So this means you've got to wait 12 hours before you can do an enrollment with this client. So guys, understand that these changes are going to modify the way we all do business. But we've got a few months to prepare for this. If you guys have any questions, please reach out to me. This is the CMS ruling. We're trying to figure out ways to be as compliant as possible, but also be able to conduct business and make money. So we find ourselves having to make the same updates that you guys are doing to our materials, our website, possibly having to change the name of our company for our retail space because we can't use Medicare in the name Sunnyside Medicare. For those, some of you, this will have no effect or very little effect. But guys, if you want to have a discussion, please reach out to me. And if you want, again, to get a copy of that 724-page guideline, send me an email agent support at 4tbrokerage.com, and we'll get a copy of that to you guys. Thanks for listening, and have a great day.